Hi everyone, this is Renee Diaz and I will be your instructor for the sensory content. This voiceover is going to cover visual assessment. It will include a brief review of the eye's anatomy, of its structure, and how it works. It'll also discuss how the eye is assessed, how it can be protected, and age-related concerns. The other two voiceovers will cover visual disorders and hearing impairments. Okay, so this is just a brief overview of the anatomy and physiology of the eye. The eye has many responsibilities, which include taking in light, converting it into electrical signals, and sending it to the brain for processing. There's also a couple of diagrams here that show you the different structures of the eye. This is an overview of visual function. Vision is controlled by the interaction of light and nerve impulses transmitted to the nervous system. As light enters the pupil, it hits the lens. The lens focuses the light rays on the back of the eyeball known as the retina. The ciliary muscles attach to the lens and change the shape of the lens depending on whether the focus is near or far away. The presence of light on the retina causes it to change the light into nerve signals for the brain to interpret. The retina uses special cells called rods and cones to process the light. Rods allow differentiation between black, white, and gray and are responsible for the form or shape of an object. They are not color sensitive, but they do allow for vision in very dark conditions. Cones require more light than rods and allow the processing of objects in color. There are 4 functions of the eye that allow for clear images no matter the distance, and they are refraction, pupillary constriction, accommodation, and convergence. Refraction errors occur when the bending of the light rays by the cornea and the lens do not focus the image correctly onto the retina. Clients with myopia or nearsightedness have trouble seeing distant objects clearly. Clients with hyperopia or farsightedness have trouble seeing close objects clearly. Clients with astigmatism have trouble seeing fine details either up close or far away due to a misshapen cornea. Accommodation is the eye's ability to maintain clear vision of an image when the object moves position. Convergence is a simultaneous movement of both eyes towards the center to visualize an object of close range. The second, third, fourth, and sixth cranial nerves control eye function, and you can see their individual functions on this table that's on the slide. This slide basically gives you a visual representation of a normal eyeball with normal refraction, as well as the errors in refraction of myopia, hyperopia, and astigmatism. There is also an image of presbyopia. This is an eye condition that everyone will eventually develop, especially after age 40. It results in ciliary muscles and lens losing its elasticity, and the person will usually end up needing reading glasses. Moving on to visual assessment. A visual assessment begins by obtaining a comprehensive history of a client's health prior to examining the eye. Some questions you may ask is, does anyone in your family have vision problems, night blindness, color blindness, or glaucoma? You also want to ask if the client's ever had a history of any visual problems. Nutrition plays a role in healthy eyes, as vitamins and nutrients have the ability to impact certain eye conditions. Obtaining a complete history of eye trauma can also provide clues to the presence of actual and potential pathologies. Visual inspection begins by noting the symmetry of the eyes on the face. You want to know any abnormal protrusion of the eyeball itself. You also want to inspect the eyebrows, eyelashes, eyelids, conjunctiva, and the iris. There are several different but relatively simple tests that can be administered to evaluate the functioning of the eye. Clients who wear either eyeglasses or contact lenses are tested with and without the corrective lenses in place. Vision testing includes the commonly known Snellen chart, which is used to evaluate distance vision. Another routine assessment of vision is the Rosenbaum Vision Screener or Jaeger card. This test is used to assess near vision and is used for clients who are unable to read without magnification. The Ishihara chart is used to assess color vision. The confrontation test is another commonly performed assessment of the eye, and it is a test of the visual fields that determine the degree of peripheral vision. The corneal light reflex and 6 cardinal positions of gaze tests are used to assess extraocular muscle function. Cranial nerves 3, 4, and 6 are also assessed when completing these tests. Pupillary light reflex is the normal expected constriction of the pupil observed when exposed to bright light. The ophthalmic exam is most commonly completed in the provider's office or a clinic setting. The physician or nurse practitioner will view the retina, vessels, and structures with an ophthalmoscope. The exam will usually take place in a dark room to allow for the pupil dilation. There are also other diagnostic tests such as CT, MRI, or ultrasound that can be used to help diagnose diseases of the eye. Using eye protection is important to prevent injury to the eye and vision loss. People are often not aware of injuries that can be sustained with everyday activities such as mowing the lawn, playing sports, or unintended exposure to certain substances and other everyday activities. The use of goggles when working at home or when doing high-risk activities is important to protect the eyes. Sunglasses are another important piece of equipment that are often overlooked. Exposure to the UVB wavelength of light has damaging effects on the eye, and there's also an association between excessive exposure and early formation of cataracts. Hand washing is another simple way to prevent injury to the eye by preventing transfer of toxic substances to the eye. There are many changes that occur to the eye as people age. As a person advances in age, the pupil becomes smaller and less responsive to light. Floaters may become evident. In advancing years, the loss of elasticity of the lens make it harder for the lens to bend in order to focus on closely held objects. The lens also yellows, and this yellowing tends to absorb and scatter blue light, making it difficult to see differences in shades of blue, green, and violet. The conjunctiva is susceptible to inflammation. Tear glands may also lose the ability to effectively lubricate the eyes, which will result in dry eyes. If you have any questions about this voiceover, please feel free to contact me. The next voiceover, we will discuss visual disorders.